for them to be released. And speaking of the hope that you talked about, I want to focus on the reopening plans that have been outlined by the state governments that are, and state and territory governments that are under lockdown, and particularly in the context of, I think it was the other day, the OECD, Australia has been recognised by having the second lowest fatalities in the OECD. That's right, isn't it?
Yes, Senator. Professor Kelly can comment on that.
That's correct, Senator. I think in the general conversation about how we're going with the pandemic, obviously that sort of comparison with international rates is often lost. The latest figures I've got from yesterday shows that we're the third lowest in terms of cumulative death rate and deaths per 100,000 population this year. So in comparison, we've had, very tragically, 336 people up until yesterday have passed away from COVID-19, mostly in New South Wales, but more recently in Victoria and one in the ACT. That compares with the US, 336,000, so 1,000 times. That's just this year. United Kingdom, 62,907. So the rate per 100,000 there, just to make it a level playing field, it's 100 per 100,000 in the US, 92 per 100,000 in the United Kingdom, 1.3 in Australia, third lowest in the OECD. Last week, a few weeks ago, so it's a little out of date, but I did see another comparison. So at that point in early September, there'd been 663,000 deaths in the US throughout the pandemic. That's 1 in 500 Americans, 1 in 500, and 1 in 35 over 80s in the US. Everyone would know someone who has died from COVID. In Australia, up to yesterday, there's been 1,245 deaths. Tragically here in Australia, that's about 1 in 20,000 Australians. So a very different comparison there during that period.
Yeah, look, that's a remarkable result in terms of fatalities, and hopefully if we get the reopening right, Australia can have both low fatalities and a very high degree of freedoms quickly returned, and so that's what I want to turn my focus to. How well placed are we to, consistent with the national plan, start to reopen at those 70 and 80% double dose intervals?
It's going very, very well, Senator, and I think it's largely due to the rapidly rising vaccination rate that has been mentioned and described by General Fruin. It's really been key to those differences. I'll just sorry to harp on deaths. Obviously, we would hope there were none, but very different situation last year and this year. Like last year, we had 909 people died in the 28,423 cases that we had. That's a death rate of 4.5%. That was mostly, as we know, in older Australians, and many of those in aged care, residential aged care. In 2021, we've had 70,609 cases. That's up to yesterday, with 336 deaths. That's a death rate of less than 0.5%. Which demonstrates very much the protection that comes from vaccination. So we know from the Doherty modelling and from other work that's been done that as that vaccination rate increases across the community, it does give protection not only directly to people that are particularly those in the more vulnerable members of our community, but also indirectly in terms of stopping the transmission from person to person. So I saw it described recently that vaccinated people can still become infected. They can still be infectious, but they are not as infectious as people who have not been vaccinated. They are less likely to be infected than those that have been vaccinated. They're far, far less likely to have severe illness compared with those that have not been vaccinated. So for all those reasons, and Professor Murphy might want to talk about the work that he's been leading with the secretaries of state and territory departments around the preparedness of the healthcare system in those phases of reopening. But what we know is that we are well prepared. That we can cope with some cases. We have treatments that are coming online as well that can assist with that. And so all of those matters are in train. I think the very key component of that is that Australians need to get used to living with COVID, that every single case is not a tragedy. Cases will be found, there will be cases, particularly in those that are not vaccinated, there will be cases in children, and we need to work through those as being a normal part and parcel of living with this disease, as many other countries are doing so.
So how far away are we from those 70? Does the department have a forecast of how far away we are from those 70 to 80% figures nationally and in those key lockdown states like the ACT, Victoria, New South Wales?
So, Senator General Fruin, Coordinator General, these are estimates. Estimates are, of course, based on supply points of presence, but then public willingness to come forward, which I've mentioned earlier. So that the variable in there, I think increasingly from here on in, is about whether people come forward. So I offer these estimates in the spirit of the numbers can change. We think nationally we get to a 70% second rate dose towards the end of October. We think we potentially get to an estimated 80% second dose around mid-November. And it's conceivable that we could get to 90% if the public keep coming forward, by the end of November, start of December. That's a best case. Now, which jurisdictions are you interested in specifically?
The lockdown ones, Victoria, New South Wales and the ACT.
Okay, so in Victoria, we think they get to 70% potentially by the end of October, to 80% about the same time, middle of November, and they could get to 90% sort of early, late November. In New South Wales, they get to 70% potentially in about a week's time. They could get to 80% mid-later October, and they could get to 90% conceivably within the first 2 weeks of November. In the ACT, we think they get to 70% within the next fortnight. They could get to 80% mid-late October, and they could conceivably be at 90% by the start of November.
That's remarkable, incredible progress. How will we assess the individual state and territory plans of those three relevant states for reopening against the national plan? Some appear, like New South Wales, to be going a bit faster. Some, like the ACT and Victoria, appear to be going a bit slower.
Senator, obviously these discussions are happening at National Cabinet, and all of the states territories have signed up to the national plan. They are waiting on detailed jurisdictional modelling for each state, and I think what's become clear from the modelling is that there will need to be some differences depending on the caseload in each state. So the modelling has shown that if you go into the 70% with a large number of cases, you probably need to maintain more public health measures than if you're going in with a low case load, because you can do more stringent testing, tracing, quarantining and isolation. So I think, as we've seen throughout the pandemic, there will be some variations that are based on the epidemiology. I think there are some of the states and territories are more conservative than others, but essentially all states and territories have agreed to take the first steps at around 70% fully vaccinated and to take more significant steps around 80%. And National Cabinet's continuing to discuss those.
Senator,
just on that model. Yes,
Senator,
sorry.
I may just add to those estimates that I gave you. I'll note that those three lockdown states are anticipated to reach those three levels potentially ahead of all other jurisdictions.
Yeah. Just on that modelling though, Professor Murphy, it has been shown so far to be probably excessively cautious, maybe even alarmist, in terms of the deaths and the ICU admissions that we're expecting in New South Wales is just one real-world example against that modelling. Is an excessive reliance on cautious modelling the right pathway, given the enormous costs of ongoing lockdowns on people's health and well-being?
So I think modelling is always, there's always an element of artificiality about it, and we've had different models. So the modelling, New South Wales had some modelling done by the Burnett Institute, which was a little bit more pessimistic than some of the Doherty modelling. I think what National Cabinet is learning in this State and Territory working group that I and a colleague in the Commonwealth Department are leading, we are learning from the real world experiences. So the New South Wales experience is going to be very valuable to guide any refinement of that modelling and refinement of approach, and similarly the Victorian experience will be as well. So I think there have been different models, and I think you're absolutely right that the experience in New South Wales has been pleasing in recent days or weeks, that we have seen a curtailment, almost certainly due to the vaccination uptake of the pandemic, and curtailment of the predicted rise in cases. So that information will be fed back into the modelling, and I'm sure all the states and territories will be looking at that. This is an iterative process, and I think that certainly the lockdown states are very keen to open up as soon as they can. But you're right, there are some that are more conservative than others.
Okay, just two final questions, conscious of the time. One is the ongoing need for hotel quarantine, particularly in those states that do have widespread community transmission. It's generally been the case over the last month that there's been at worst 1 or 2 cases a day in hotel quarantine in New South Wales and Victoria, when there's been many hundreds, if not thousands, of cases in the community. How much additional protection is hotel quarantine offering, given the very high cost that has? I mean, I think it was a necessary thing prior to vaccination, but now that we have vaccination, it's a different equation.
I'll get Professor Kelly to answer that, Senator.
Thank you, Senator, for the question. So that is a live issue. I think you've pointed that out, and because these data are shared widely and publicly every day, it's become pretty obvious where the problem is. The problem is in local transmission in New South Wales. As you've pointed out, we're getting a handful of cases through the hotel quarantine system, and up to 1,500, I think, was the highest rate number in New South Wales a couple of weeks ago. So it is an immaterial number at the moment. In Howard Springs, for example, in the Centre for National Resilience, again, almost 2,000 people in that centre at the moment. It's been rare over the last few weeks, even including the evacuees from Afghanistan, to have more than 2 or 3 cases in that group. So it's becoming less of a problem. Partly that's because of the mitigations that are happening before people travel, so having tests before they leave and wearing masks and the like. So it's a live question about what needs to be done there into the future, and it's certainly part of the national plan is to pull back on what is required at the national border. There are many pilot projects at the moment in New South Wales, in South Australia, and other states to look at alternatives in terms of quarantine.
And that's very encouraging, and I'd be just keen to accelerate that as much as possible. Chair, just one final question, if I can have your indulgence, please. What is the public health rationale for 2 states, namely Victoria and New South Wales, that have similar rates of community transmission, to have closed their borders to each other? What are they protecting each other from by continuing to close their border to each other?
I think I would suggest you put that question to the medical advisors in those 2 states.
Does that mean that you're not aware of a public health rationale for it, that there isn't one?
I think I'll just stick with that answer.
Fair enough. Thanks, Chair.
Thank you, Senator